In the last episode of Timmy Talks, we visited Giostar, where we had an in-depth discussion with Dr. Angadi on what stem cells are and the services that they offer here at Giostar in Bangalore. Today, I actually am going to have some consultations, one for my hair and one for my hips, and see what Giostar can do for me. Come along, this should be interesting. And my first meeting for my thinning hair is with Dr. SIRAJ from the Reju Age Skin Hair Beauty Clinic and also Dr. SOMASHEKHAR from the Government of India.
Nice to meet you.
Nice to
Welcome
meet
to
you.
India, sir.
Thank you very much. Thank
Yes,
you.
sir.
Hi there.
And Dr. Somshekhar,
Nice to meet you.
cosmetologist, and is
I am a
Dr.
dermatologist,
Siraj Pasha,
Very nice.
dermatologist.
dermatologist, and a trichologist,
Very nice.
cosmetologist.
Cosmetologist.
Yes,
Okay.
I'm a dermatologist, cosmetologist,
Wow.
and trichologist.
What's a trichologist?
Trichologist is a specialist in hair.
Hair.
Really?
Yes.
All right. Well, this is the guy I want to talk to.
Excellent. I'm glad I could make that connect for you.
Yeah,
today.
thank you so much.
So please go ahead for the
Okay, awesome. Thank you.
Very nice of you.
So, with any good consultation, there is an examination. And this was a very interesting tool that actually looked at the follicles of my hair to see if there was any intrinsic problem going on with my scalp. And that was so cool. They took so many photos of my scalp, and you could see all the little hair follicles and all the little damage there on my little hair. It's like, how did that happen? But wow, that's magnified like thousands of times. It's crazy.
So it is very essential to know first what is the diagnosis. Why did you lose the hair? See, there are 1,20,000 hairs.
And next came a series of questions regarding my diet and what I've done to date to prevent my hair loss. And I explained to them that I've been taking Propecia and minoxidil and using light therapy and using hair loss shampoo and the whole gamut. I think I've tried everything over the years to stop hair loss. And I wanted to see what else they could do for me. Okay, so
Sure.
what is your thoughts on my hair loss?
You have more hair loss on the frontal
Frontal
and the temporal regions. So, since it is there for a long time, and you told me that you are taking Propecia from a very long time, of almost you said about 20 years, I request you not to continue the Propecia because you are taking it from quite long time.
So tell me, because I've not heard that before. So tell me, what are the downside of being on Propecia for a long time?
Sir, what happens here is, as we know very well, Propecia is usually given in prostatic problems.
Prostate problems.
Yes.
Yeah.
Okay. And whenever we give Propecia, we give usually for a short period because Propecia also have adverse side effects. So we don't want any side effects to happen
Yeah.
to the patient.
Yeah.
And also, even if you are taking, say for example, a few months also, we mandatorily should do the complete investigations like CBC, an ESR, an LFT, a KFT, and the lipid profile.
So doing complete blood work when you're on Propecia
Very
is
true.
important.
Very true. In fact, any of the medicines, if you use more than 3 months, it is mandatory to make complete blood test to see whether all the organs of the body are in order.
And I like this approach that they're taking here at Giostar. They want to make sure that you have covered all of your bases, that you do blood work to find out if there's some intrinsic problem going on, some systemic problem going on, before just slapping some medications, to the issue. And I think that that's a very different approach than we have in America. In India here, they want to look at the whole person, the whole being, to make sure that you've covered everything before you go, to the next level of treatment. Can you share any degenerative issue inside your body that may contribute or cause hair loss? Because I've
Of
not
course.
heard that.
Of course, many of the problems of the connective tissue disorders and autoimmune disorders, hair loss is an integral part of these diseases. And that is the reason I am insisting that a blood investigation is mandatory to find out what is happening.
Sure.
Because the main cause or the main diagnosis is different. The hair loss is only a symptom. So if you just treat the symptom,
Yeah.
it is not enough.
Got it.
So
Makes sense.
You treat because in case the symptom of hair loss is only indicative of some major problem inside the body. So if you are neglecting the symptom and if you are not diagnosing the main problem, then down the lane you may enter into a bigger issue and a bigger problem. So it is better to solve the problem at the early age and protect the patient.
Makes sense. Very good. So, doctor is a very strong proponent of prescribing vitamins and minerals to all of his patients who are having thinning hair loss, and using that as the first line of treatment. And then adding things like Propecia or minoxidil to that treatment plan as needed.
In my practice of 40 years as a dermatologist and trichologist and cosmetologist, and I am also a fellow of the American Academy of Dermatology, I strongly recommend to give multivitamins to patients who are having the hair loss and hair thinning problems. Approach is, for example, we would like to go, how much is the hair is being lost? Many of our patients in India, they come for hair loss. Number one, multiple patchy hair loss, that is we call alopecia areata, and the thinning of the hair. And in India, we do get graying of the hair, premature graying of the hair.
Sure.
So our approach is, first we try to give the best of the serums available in the world to apply to the scalp, and we give the best of the shampoos to be used together with the serum. And in addition to this, we would like to give them, as I said, the multivitamins with the minerals. If they are not happy, we do have other procedures. As you rightly point out, light therapy, and we have the laser therapies also in India. They do help, and I have seen successfully. It is the second step. We go step by step.
Sure.
If they are happy, they are all right with the serum and the shampoo, then no need to give them other.
And I like the approach that they're taking here, that, treat the problem, do some investigation first to see if there's any systemic issue, then treat the problem by first giving vitamins and minerals. And if that's not successful, you can add some medications, but also add serums and hair shampoo that grows your hair, and things naturally. The doctor does offer and have some products that are naturally made and not all chemicals that force your hair to grow. And, it kind of surprised me in general that they did not immediately jump to, stem cell as a therapy. But that is, down the line, that is something that could be offered. But they take this systematic approach to healing, looking at the very basics and building upon that as the patient needs it. And I appreciate that the doctor gave me some samples to try of both the hair serum and the shampoo. And I'll have to get back to you on how effective it was. But I really do appreciate that they took the time to meet with me and give me a consultation on my hair loss and give me some recommendations and suggestions and some things to try for my hair. So it was a very successful consultation. Okay, so the office is beautiful. How long have you guys been here?
This is the third year.
Third year. That's very nice. So here you have conference room.
We have a conference room.
And this is where patients come in and you might meet with them, or what do you...
We conduct our official meetings, the doctors' meetings and staff meetings, everything here.
Okay.
And for patients, we have specialized cabins.
Okay.
Where as soon as the patient enters, they does all their initial desk work, that is of patient details, the basic things that we do. And we have 1, 2, 3, 4, 5 cabinets.
And
where we do personalized patient
consultations.
Yes.
Okay, very good. And it's very, just so people know, very private in here.
Exactly.
And I didn't hear anybody in the next room. So
Yes,
yeah,
exactly.
it's very good.
Yeah, and it's so transparent as well.
Yeah. Now, in terms of where services are actually performed, like the stem cell services
Yes,
themselves.
actually.
Okay. So that was like the meet and greet area, or?
Yes, exactly.
Great. So the building has 4 stories. Wow.
Yes.
Okay.
Welcome to our conference area. We have a huge.
Wow. 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 This is huge.
This is our conference room.
Wow.
Where we conduct all the CME meetings and all other programs and everything here.
Very nice. Wow. It's huge. I love this outdoor space. Wow.
So what we do is that we keep stalls.
Yeah.
So that for any demo purpose or anything like that,
Yeah.
we
That's,
have
that's
stalls.
a nice space to do that. Yeah. So you guys have conferences here? Do you
Yes, we do
talk
have
about
conference,
stem
yes.
cell?
Yes, exactly.
That's great.
So in second floor we
Oh.
have 5 bedrooms.
Okay.
When patients, the procedure is done,
Oh,
you just shift them here so that you can have relaxing here.
very good.
We keep them for observation here.
Yeah, that's nice. So when someone has stem cell therapy, like for cancer or something,
Yeah.
then you monitor them for a day or so
Exactly, yes, we do.
to make sure that everything's still going fine.
Yes.
And if there's not, you have the capability of taking care of issues here or stabilizing them and then transferring them to a hospital.
No, we keep them here.
Huh.
Yeah.
Okay. Very good. That's excellent.
And here we have a small physiotherapy sessions here.
Okay. Nice. That's great.
Yeah.
So it really is a hospital. So that's nice. Where is that conducted? Where they use the cannula and take the fat out of someone?
I'll show.
Oh, it's here.
Yeah, we do harvest the stem cell from here only. So this is our main part.
Okay.
We
Hello.
have 2 staff nurses, Sunita and Deepa.
Hi there. Nice to meet you. That's awesome. And this is another nice floor. Wow. That's
We
great.
have 2 bedrooms here,
Okay.
and the main part is our laboratory.
Oh, the lab is in here. Yeah.
Lab, you don't have permission because it's like a
Secure. So
Secure
yeah.
place.
But the actual lab portion is in here.
yes, all the major research and everything
Right.
is cells, how
Right.
culturing and all happens
Correct.
there.
Oh, very nice.
Yeah.
Very
And
nice.
this is our operating theatre.
Oh, wow. That's fascinating.
Yeah.
Wow.
So all the magical medical procedures
Yeah,
are
right?
done here.
That's great. Oh, I love it. That's
It's all
awesome.
interconnected. That's the chamber, and
Right.
the other side is the lab.
Right, and then I'm sure that the lab over there is all, what's the word I'm looking for? Secure with hygienic
Exactly,
and,
sterile.
sterile. That's what I'm
Exactly,
looking for.
yes,
Yeah,
yes.
that's the word. Yeah.
Both the lab and the operating theatre.
Yeah, sure. That's awesome. Thank you so much for showing me that. Because people want to know,
Exactly,
everything is
yeah.
really done here.
Yes,
So
yes,
that's
yes.
great.
How to do it,
Yeah, that's great. I loved it. Well, it's a nice facility. So today at Giostar, I am actually coming in as a patient. If you remember last year when I went to MedPlus, I had a DEXA scan, and the DEXA scan checks your bone density throughout your body, and they actually indicated that I have a little thinning of my hip bone. So once in a while it bothers me, and since I've been in here in India doing a lot of walking, it's bothering me a bit. So I thought this is perfect to come see and what a consultation would consist of, and go through the process with you, so you get an idea of what happens at a facility like this and what their recommendations would be. So come along, it's going to be actually cool to add this to the video.
Please come. Please sit.
And again, as with any good consultation, some initial analysis is done. My blood pressure, my oxygen, my temperature are all taken, and everything was good.
So let's begin with some of the hip things that you mentioned.
Yeah.
Okay. So what we will do during this consultation is I'm going to ask you a series of questions, and then I'll have a feel of your hip and maybe the rest of the joints and other parts of the musculoskeletal system.
Sure.
And whatever reports you've got, we'll go through them,
Okay.
and then we can have a chat about what we need to do and what we've got in terms of treatment options.
Okay.
Is that okay with you?
Absolutely.
Fantastic. Okay. So I'll just grab a chair.
And I think probably from my late 30s, I had once in a while discomfort, like if I really overuse my legs,
Yeah.
if I run or jump or do things, felt it way back then. But progressively, as I've gotten older, it's just aching more and more. There's times that I even am just laying in bed and it's like, I can, it's like I can feel that there's an issue. I have to put pillows between my legs when I sleep, so it keeps my hips straight.
Yeah.
If I don't, then I have a problem with my hip.
Right, right. Okay. And as years have gone by, have you found that the intensity of the pain or the frequency of the pain are both increasing?
Not the intensity, but the frequency.
Frequency.
For example, coming here to India and just doing a lot of traveling, carrying my heavy bags, just doing things that I'm not used to doing, I feel it these past couple days in my hip. So.
Noted, right. And any specific movements that you found kind of provoke that pain?
No. Maybe stairs, like Stairmaster at the gym. If I like do it a little too long, then the next day I can feel like, oh, okay, I really hurt my hip.
Okay. And when you get these bouts of pain, typically how long do they last?
A couple of days.
Couple of days.
Yeah.
And they tend to ease off on their own, or do you have to take medicines or apply some gels or ointments?
I try not to take medicines as much as I can. Sometimes I do, like a Tylenol or something like that. Generally, they tend to go away on their own if I take a hot bath or a hot shower, try and relieve the muscles there. It eases off. Another thing, which I think is very interesting, is from a dietary perspective. I know I have an allergy to milk.
Right.
And when I do eat milk or cheese, and I've been having milk with all my coffees and chais here, that actually activates my hip from hurting. So from a dietary perspective, I do know that if I start eating milk, it bothers my hip. I think that's kind of weird, but
interesting.
it's
okay.
true.
And the pain that you experience, is it just localized around the hip area,
Yeah,
or
that's
does
it.
it shoot down your leg at all?
No, just the hip, and actually maybe parts of my back. You'll see in that DEXA report I have a little scoliosis in my back. So it's just when this is aggravated and thrown off, it throws my back off as well.
Right, right. Okay.
The next few minutes of my consultation really consisted of going in depth about any past medical conditions, asking the normal questions about medications and all that. I won't bore you with that, but needless to say, the doctor did a very thorough job trying to understand where my baseline is for my health, and he can go from there.
So I think that's all the basic information that I need from your side.
Okay.
So we'll get you to do a few maneuvers,
Sure.
and then I'll get you onto the couch and we'll have a feel of your joints.
Sounds good.
And then we'll go through the reports, and I'll be able to tell you what we need to do.
Sounds
Alrighty?
good. Very good.
Okay. And can I get you to walk a few steps just at your normal pace? Okay. We're trying to see if you've got a normal kind of a gait pattern, or what we call as an antalgic gait. In some patients, when they're in a lot of pain, especially from the hip or the knee or the ankle or from the back, they tend to have that.
Yeah, I can see. I can see where if someone's in a lot of pain, they're doing something funky.
Correct. Okay, that's good. Excellent. And if I can get you to turn and face the wall, please. And then I need to look at how your alignment is in what we call as the sagittal plane. And again, it looks fairly acceptable. Okay, now the fun bit starts.
Okay, great.
So I need to look at specifically certain muscles around the hip. These are called as the abductors, and they help us to do this.
Yeah.
But they're equally important in terms of a balance and how the pelvis sways when we walk. Okay, so what I'm going to do is I'm going to come and give you my hand. And first, I want you to stand on your good leg. So if you mirror what I'm doing, that's good. So bend that ways. Fantastic. Okay, now can you swap sides for me, please? Fantastic. Okay, right. And if I can get you to sit at the edge of this couch. Okay, so your knees seem to be fairly well behaved so far.
Yeah.
Okay, can I get you to straighten the knee? Brilliant. Bend down, straighten it out again, and bend down. Okay, so your kneecaps track quite well within the knee. Okay, straighten it out, bend it down, straighten it out, bend it down. Okay, is that movement triggering any discomfort or pain in your hip?
A little bit.
A little bit?
Yeah, a little bit. You know, all of my pain is like at the, maybe it's referred, I don't know, but it seems to be right at the edge of the hip here.
Got it. Got it. Okay. And if I can get you to lie back, please. Okay. So what I will get you to do now is please keep your knee straight and lift it up and hold it there for me. Beautiful. Okay. And let's do the same on this one. Can you hold it there for me? Good. Any pain or discomfort when you do that? Just there, isn't it? Okay. So I'm just going to try and feel on the side of your hip here. So we'll start up on the lateral or the outer part of your thigh. And if I keep coming up, tell me if I'm hitting any pain spots. So is that where you feel some of the pain?
There's a little bit right there.
Yeah. Okay. So you wince there when I do that.
Right there.
That's the spot?
Yep.
Okay, dokie. Alrighty. Okay. So I'm going to go a touch to the back and tell me if any pain in the back there.
Right there.
That's also sore. Okay. And up in the front part of the thigh?
No.
That's okay. Good. And if I were to just roll your leg in and out, does that bother you at all?
No,
not
really.
much. Okay. So we'll start with your good hip. So if I can get you to bend the hip for me as much as it will bend, that's good. Okay. And straighten it out. Okay. And bend this one as well for me. Good. Any pain? It's the same there, isn't it? Okay, good. And can you swing this leg out towards the head of the bed? Okay, and then back here. Good. And this one as well for me. Good. Any pain when you do that?
Not really.
Okay. So I'm going to now do something called as passive movements. So I'm going to test your hip. So that's not really comfortable for you.
No.
But this seems to be okay. And if I were to do this, what we call as the internal rotation of the hip.
I feel it a little bit.
Yeah, you feel a little bit something there, isn't it? Okay. And if we were to do the same on this one, if I get this, it's comfortable and the other hip is fine. Okay. Just going to swing your hip out. So tell me if there's any pain there. That's okay?
It's fine.
Good. And if I can get this out, any pain there?
No.
Okay. If I bend your hip out like so, and if I were to press there, any pain?
Yeah.
You feel that? Okay, good. And if we do this on this side, any pain in your back or your hip? That's
No.
all right. Good. Okay. Now, if I can get you to pull your toes up and keep your toes there. Don't let me push them down. Fantastic. Keep it up. Fantastic. Okay. And keep your foot up there. Good. Keep your foot up, 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 up. Good. Can you bend this knee for me, please? Okay. Now keep it bent, bent, bent. Keep it bent. Okay. Don't let me pull it straight. Very good. Okay. Let's do it on this side. Excellent. Okay. And please straighten both your legs. Okay. So I want you to just keep your leg there. Stop me from pushing it in. And let me know if there's any pain when you do that.
A little
A little
bit,
bit.
yeah.
Okay, fine. Let's do the same on this one. So Lord, stop me from pulling it to the middle. That's okay?
It's fine.
Okay. Now if I can get you to sit up, I'm going to press on your spine. So let me know if I'm hitting any painful areas in your back. So that bit, which is your thoracic spine, all seems to be good. So as we go towards your lumbar spine, no pain there.
It's a little tender right here, but
Yeah.
not pain.
And this area here, do you get any discomfort low down here?
No.
And that area on the other side seems to be okay.
Maybe, yeah, low, like low.
Just down that area there.
Yeah.
Okay. Right. Fine. I think certainly there is a musculoskeletal cause for this kind of pain. Please come and musculoskeletal structures is quite a given. Okay. But the rate at which this happens depends on how we manage our own body. Okay. And some of the important structures around the hip are basically the muscles, which are the abductors. They seem to be working well, but every time you have an injury, it can upset the balance and it'll take a bit longer for the tissues to recover. The next thing is to do with the hip joint itself. The hip is a ball and socket joint. So you've got to have a smooth surface moving with a very smooth surface. Otherwise, it affects how the hip moves, which basically means the amount of work that the muscles around the hip has to do becomes a bit more. And that can trigger pain. So it might not be a muscle problem to begin with. So if it is a cartilage problem within your hip, and if the cartilage is not moving as smoothly or as efficiently as it did maybe 15, 20 years ago, that extra work on the muscle can tire the muscle, can fatigue the muscle. So they will be like, God, give me a break. I've had enough. Okay. So you start to experience this kind of dull, vague pains, which you can't really put a handle on. But certainly there is a pattern in what you've been describing to me in terms of certain movements or certain physical activity, which triggers that pain. So that means there is a mechanical element to this. So whenever we have a patient come to us, we always try and look at, is there a particular biological cause or is there a particular mechanical cause? And quite often there is a big overlap. Now one might trigger the other. Okay. So a good example is patients with rheumatoid arthritis. Fundamentally, it's like a biological problem. It's like their autoimmune condition, which is damaging and destroying all those kind of vital structures around the joints.
Right.
But then it becomes a mechanical problem because once the cartilage is damaged, the joint is not moving efficiently. So they then get all these secondary symptoms and they get joint deformity.
Sure.
Yeah. So in your particular case, I think the way forward will be to get some structural information. Okay. Now, when we talk about structural information, I need to look at the bones and I need to look at the soft tissues. And if you ask me whether there is an element of referred pain, possibly yes. Okay. Now, when we talk about referred pain and when we are looking at a particular joint, so let's say people have pain in the knee. Okay. The knee may be perfect on examination, but they still localize the pain to the knee itself. So in those cases, it's mandatory for us to look for the joint above, which is the hip. And it's quite often that when we examine the hip is very stiff and they get a lot of symptoms from there, but they're not aware of it because the pain is getting localized there. So in your particular case, I think given the fact that on your DEXA scan, it mentions some problem areas around the lumbosacral spine. There can be an element of referred pain, but also your hip, when we examine it, has certain restrictions, especially when we come to the abduction movement and when we look at the internal rotation movement. You're not comfortable with that. So it tells me that there may be a combination of sources of pain. And if we were to try and address this problem in its entirety, we have to look at both of them. Okay. So where do we go from here? As I said, some structural information is what we need. We need to look at an X-ray. That will give me some idea about what the bones are and how the alignment is around the pelvis and both the hip joints. The good thing with the hip is God has given two. So I can compare like for like, right? So I can compare and contrast what your right hip is looking like with your left hip. The next thing is specifically if you have to look at the cartilage aspect of your hip joints, then we need to look at something called as an MRI scan or a magnetic resonance imaging. And these days they're so good, it's as good as putting a camera inside your hip joint and looking at its entirety because of the resolution.
Right.
Okay. So these two will give us some idea about what's going on in terms of the mechanics of the hip joint. Now for the spine, I need to go through some of your previous investigations. If you've already had those covered, then we can just look at them. And I need to look at certain things which we call as disc bulges or disc protrusions. The spine again is like a column, and if you have the bone and the disc, with wear and tear, you tend to get certain bulges, and they can tickle or irritate the nerve roots which supply the hip area, and that can also cause this referred pain. So if that is entirely normal, then we know for sure that the bulk of your pain is coming from the hip joint per se. So whatever treatment protocol we design has to be addressing the hip. Okay. So that will give us some structural information. In terms of biology, we can look at certain blood markers, because whenever we have certain joint pain, it can trigger some element of inflammation. Okay, so we need to look at certain specific inflammatory markers, and quite often we request something called as the C-reactive protein, the ESR, and look at your blood counts, and this will give us some idea about how things are. And this is a very baseline information. Whatever we do in terms of treatment protocols for you, it'll always address the biology, it'll always address the mechanics, and quite often it will be the combination of the two, and we design that as a structured treatment protocol for you.
Yeah, very good. And again, like we had talked about the other day, your approach to this is like looking at the whole person, looking at all of the issues and components together. So I really appreciate that.
Thank you.
Yeah.
Thank you. So
I did bring in my report that was given to me in my other video from MedPlus about my DEXA scan, and the doctor reviewed it and had some thoughts on it.
but the good news is this can be easily rectified. Most of it, as the letter here says, it's a combination of certain lifestyle changes, certain dietary modifications, and good exposure to sunlight and adequate water intake. And because the totality of you in terms of biology is quite good, so I would expect that you'll have a good response. And if you see, one of the recommendation that they mentioned in this letter from last year was that you need to have a repeat of your BMD. So if you've implemented all those changes in this year that has just gone by in 2023, then the expectation is when you have the scan as of it should come back as, you know, you having changed a lot of those osteopenic areas and coming back towards normality. Okay, if not, we'll have to implement these changes as of now, and going forward my expectation is that if you build in these changes, small subtle changes into your daily routine, then in a year's time things will be back to normality.
Now, if someone wants to get in contact with your organization or you in general, how do they do that?
So we've got a website, and we'll get you the details of the website. There's a contact email address and some phone numbers, and we've also got a form on the website where people can put their details in so that my team can get in touch with them.
I will include that in the information of the video, and I'll also put it on the video below us right here so people can see. Very good. I want to thank you again for the whole interview, taking time today and giving me a consultation and going through this whole process. I think people will find it fascinating as much as I have, but also I think it's going to help a lot of people, which is really important.
Thank you for your time.
Thank you. So amazingly, my visits today cost me about 18 American dollars, which is just unbelievable. You know, the biggest thing about India, as I've said before, is access to medical care. And if you're looking or thinking about coming to get some stem cells, come visit this Indian office in Bangalore. They will look at you as a whole person, try and figure out any issues that you have and take it step by step. I hope you enjoyed this video today as much as I did. See you soon.